Welcome to The Explainer. You know, there's a $250 billion problem hiding in plain sight inside the healthcare system. And no, it's not some new drug or fancy surgical robot. It's the absolute mountain of data, claims, orders, patient info that has to move through every single hospital and clinic every day. We're going to break down how to stop drowning in that data and actually turn it into one of your most powerful strategic assets.
So here's how we're going to tackle this. First, we'll get a real sense of the problem, the staggering cost of doing things the old way. Then we'll introduce the digital solution, see exactly how it works, and map out a clear path to get you started and, most importantly, fully optimized. All right, let's kick things off by putting a real number on this problem. A problem that, most people in healthcare feel every day, but rarely see quantified. We're talking about the crushing weight of administrative tasks. Yep, you're seeing that right. A quarter of all healthcare spending in the U.S. goes to administrative work. That is an unbelievable $250 billion with a B every single year, all spent on paperwork, typing things in by hand, and just managing the flow of information for claims, orders, you name it. And look, this isn't just a number on a spreadsheet. This administrative friction, it has a very real human cost. Think about it. One simple data entry mistake can delay a critical shipment of supplies. A paperwork error can get a claim denied. These aren't just little inefficiencies. They lead to staff burnout and can absolutely have an impact on patient care. So that leads us to the big question, right? What if all of this wasn't just a necessary evil? What if you could flip the script and turn this whole process on its head? Well, that's exactly where our digital solution comes into play. Let's pull back the curtain on the technology that answers that very question. It's called Electronic Data Interchange, or for short, EDI.
The easiest way to think about EDI is like a universal translator for all of healthcare business. So instead of dealing with faxes, paper forms, and spending hours on the phone, EDI creates this common digital language. It lets all the different systems, from a hospital's procurement software to an insurer's claims system, talk to each other automatically and without any mistakes.
And let's be clear, this is not some niche, up-and-coming technology. We're talking about a market that's already worth over $4.4 billion, and it's growing at almost 10% a year. What that tells you is that this isn't an if anymore. Adopting EDI is pretty much a critical strategic move just to stay competitive.
And the reason for that massive growth becomes crystal clear when you just look at the benefits. Right off the bat, you get rid of manual errors. You speed up everything, from ordering supplies to getting paid. You get a real-time window into your supply chain. You bake in regulatory compliance from the start. And really, the bottom line is you free up your people to focus on what actually matters, taking care of patients.
Now check this out. This chart really drives home the financial impact. According to the data, a manual transaction costs almost $5. That same exact transaction, when you run it through EDI, costs just 67 cents. That is over 7 times cheaper. Now just imagine multiplying that savings by the thousands, or hey, even millions of transactions your health system handles every year. The numbers just become game-changing.
Okay, so we get the why. It's a no-brainer. Now let's get a little more practical and look at how EDI actually works day-to-day inside the healthcare world. So every single EDI transaction, doesn't matter if it's a purchase order or an insurance claim, it follows this really secure, structured path. First, the data gets translated into that standard EDI format. Then, and this is key, it gets validated to catch any errors before it's even sent. After that, it's zipped across a secure, encrypted connection. And finally, the receiver's system just translates it back into whatever format it needs. Simple, right?
And here, you can see that whole ecosystem in action. It's like a constant, automated conversation. A hospital sends out an EDI 850. That's just a digital PO. The supplier automatically shoots back an 856, which is basically a your stuff is shipped notification. And then an 810, the digital invoice. At the same time, the hospital is sending an 837 claim to an insurer, who then sends back an 835, which is the payment advice. This is the digital backbone that keeps modern healthcare running.
So, to get all these amazing benefits, your organization has to become EDI compliant. And that journey really starts with one fundamental strategic choice. You're basically at a fork in the road here. You've got 2 main paths. Path 1, you build the entire EDI system yourself from scratch. That means a huge investment in tech, people, and constant upkeep. Or there's Path 2. You partner with a specialized EDI provider who handles all the tech, the infrastructure, and the connections for you. So you're guaranteed to be compliant, and you can just focus on running your hospital. But hang on, because just being EDI compliant, that's really only step one. If you want to get to true optimization, you have to look even deeper into your procurement process to find savings that, honestly, even a lot of organizations with EDI are totally missing.
This number, this is the estimated premium that hospitals pay for every single item they buy that's off contract. This is what happens when, some department just buys something from a supplier you don't have a deal with, or they don't get the negotiated price. It's literally just money walking out the door every single day.
This slide shows what we call the contract compliance gap. It's really simple. On the left, you've got all the savings your team worked so hard to negotiate in those big contracts. And on the right, that's what you actually save. That gap in the middle, that's all the value that leaks out because of off-contract spending. And believe me, it can wipe out a huge chunk of your projected savings.
Now this is where a specialized tool becomes absolutely essential. Solutions like this plug right into your procurement system, and they act like a guardrail. They give your team total visibility into contract pricing right when they're about to buy something. This basically stops that non-compliant spending before it even happens and makes sure you get every penny of savings you fought for.
So for those of you who see the power in outsourcing and really optimizing, what does getting started actually look like? Well, the good news is it's probably more straightforward than you think.
A really good provider is going to walk you through a clear 6-step process. It all starts with them really digging in and understanding your specific needs. Then they handle all the heavy lifting, setting up the tech, mapping your systems, and testing every little thing to make sure it's perfect. The final piece of the puzzle is just training your team so that everyone feels confident and ready to go.
And that's really the crucial takeaway here. Look, going from manual to EDI is a massive win, no doubt about it. But taking that next step to proactively manage and enforce your contracts, that's what separates the good organizations from the truly great ones. It's how you turn your supply chain from a simple cost center into a real strategic weapon.
And that really brings us to our final question, the one I want you to take back to your own organization. Right now, today, is that mountain of data you're dealing with a source of cost, a risk, a liability, or is it a streamlined strategic asset that's actually driving savings and making things better? With the right tools and the right approach, the answer absolutely can and should be the latter.